honestly, if I'm being like totally honest, like I think I would have stayed, but they fired me, which is a very difficult thing that I actually don't think I've talked about publicly because there's a lot of shame that's associated with that. But I also think that, there are people who've been in similar positions, and I don't want people to feel guilty or bad that just because you had a bad experience like that you can't grow past that and do something really great. Looking back 2 years later, I'm really grateful for that because I think otherwise I would have stayed and I probably would have plateaued there. I wouldn't have gotten to where I'm at today.
Welcome to the Prehab Podcast, where we dive deep into expert insights, connect with industry leaders, and share real stories to help you take a proactive approach to your health. I'm Michael Lau, a doctor of physical therapy and co-founder of Prehab, and today I'm joined by a very, very special guest, my wife, Dr. Adelle Smener. Adelle is a clinic director at Prehab Physical Therapy, where she not only manages clinical operations with expertise, but also passionately treats each and every one of her patients. She has a special focus on post-operative knee injuries like ACL and meniscus surgeries. She is a force in the world of physical therapy and is deeply committed to elevating the profession's standard of care, focusing on optimizing patient outcomes while also fostering professional growth and preventing clinician burnout. But there is so much more to Adelle than her impressive professional achievements. She is also a passionate dog lover, dedicating her free time to volunteering and advocating for rescue animals when not advocating for her patients in the clinic. Together, we will share how we opened up our clinic in Culver City during the pandemic, first as a film studio and then quickly growing into a thriving physical therapy practice. We'll also discuss some of the challenges we faced early on in our careers, particularly the importance of autonomy and finding the right work environment. We'll also touch on the complexities of working together as a couple, how we navigate communication and balance, and also our broader mission to make high quality care accessible both in person and online. This podcast offers a rich blend of professional expertise, personal storytelling, and practical advice, making it a must-watch for anyone interested in healthcare, business, relationships, or simply hearing an inspiring journey. Let's dive in. All right, Adelle, welcome to the show.
Yay! We made it.
Is this our first ever? I think this is our first ever podcast together.
Yes. Well, this is my first podcast ever, so that would.
No, you've been on podcasts before.
I know. I'm just kidding.
First Prehab podcast together. A lot of firsts today. We're going to be talking about one of our first, business projects together, the creation of PrehabPT, which is really, really exciting. So I don't know how many people know the story and the origins of PrehabPT. In 2020, Craig Rush and I, we got to the spot here in Culver City because we needed a film studio. All the gyms during the pandemic had closed down.
Are you telling me this?
We were filming all the time. Every gym was closed. So we decked this place out, created it to look like a physical therapy clinic so we can start filming. And our thought was, we'll have a place to film and we'll have a place to treat patients. But we had really no structure, no process, nothing for the online business there. We just took our old patients that we were treating in other clinics and just, hey, come, we'll work with you guys over here. And it wasn't until you joined about a year and a half later that really a lot of our process and structure started, and it's grown so much in the last 2.5 years. That's thanks to all your hard work and your dedication. It's something that you're extremely, extremely passionate about. Yeah. So thank you.
Yeah, it's been a fun journey. Yeah, I started officially with you guys in 2021. I think it was like summer. But obviously I've been a part of the journey way before that. I'm the OG. No one knows I'm the OG Prehab guy, actually. I am the founding father of the Prehab guys.
You are the first camera woman.
That is true.
The post number one.
Yeah.
Yeah, from the Calabasas Recreation Center.
Yeah.
I think.
It's like Calabasas Tennis and Swim Center.
That's what it was.
Yes. Yeah. That was like, that was in PT school. That was like 27.
That could have been 2016. I think we filmed it December 2016.
Yeah. So, officially joined the team in 2021. But obviously our history goes further than that. Mike and I actually went to PT school together. We were roommates, classmates, friends. Then we started dating, and then we got engaged, and now we're married, and now we work together.
Now we're parents.
Oh, and now we're parents. We have 2 dogs too. A lot has happened over the last few years, both like personally and professionally. And I think the beginning part of my career was like a little bit frustrating. So it's just been really fun to be part of your guys' team. I obviously like love you guys as friends and as people, and support you guys in every which way. And now it's just exciting to be part of that journey and be part of the growth and be part of the change that we like advocate for so much. and be able to help people locally. I know the online business has done a really good job of helping people across the world. But there is, I feel like, still a barrier where people have a hard time understanding that like you can get access to good healthcare and PT, remotely. So I think for the people who do live locally, it's really important for me to be able to help educate and help them understand that they have options when it comes to in-person PT too, that they don't have to settle for things. So I think that that's where like my passion really came into play when we started Prehab Physical Therapy.
And I think you had a really, really unique background and first like 2 to 4 years too from a professional like journey.
See, sadly, I don't think it was that unique.
I think it was very unique and it formed the clinician that you are now, and also feel the passions that you have to drive the changes and to drive what you created in PrehabPT. Because unless you have some hard times, some tumultuous times, some difficult challenges, you learn from those, and then you put all of those learnings into what type of environment you want to create for yourself at PrehabPT and for your patients there, but then also the team that's there. And that's similar to kind of like how the online business and Prehab came around. I had patients that I'm like, they can't get in. How can I see more patients? My schedule's packed. I had a max of 13 back then. How can I help these people out more? Well, we need to have digital options. And you took similar problems for the clinic. So I guess what were some of those challenges that you were faced with early on in your career, which I know at the time were tough? I think you had 3 or 4 different positions and jobs within the first 3 or 4 years or something like that. Maybe share some of those stories with the audience.
Well, disclaimer, I'm a very difficult person to please. I have very high expectations, so no shade to the places that I, worked at previously.
But I met those expectations.
Mike has met those expectations. Lucky him, lucky me. But yeah, I think, and the thing is like, I think what I've done with that is unique, but I think what my experiences in themselves are not unique, and that a lot of people are still living that, right? I think it's like what I've made out of it and what I've done with it, and my expectations have changed based on that. So I think when I graduated PT school, and I think this goes for a lot of people, like you graduate, you're super excited, like what's it called? Like big-eyed, doe-eyed, whatever, just like about all like the experiences out there. And I actually joined a team right where I finished my last clinical rotation. And I loved the people I worked with, like great clinic culture. Like everyone had lunch together every day. It was like truly like a family. And I loved that so much. And then I think I just outgrew the patient population. It was like a lot of like geriatric, kind of like very, very general ortho. And it's funny because I never thought I wanted to work with athletes. I think I literally remember being in PT school being like, I don't even feel bad for runners. If they can run like 5 miles, like they're lucky, like blah, 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 blah. Like I just never understood it.
You wouldn't give me crap. Like, why do you want to work with athletes? They already can run. They can already jump. Like, don't you want to help other people? I'm like, I want to help everyone I possibly can. I just feel maybe a little bit more challenged sometimes by higher level patients.
Exactly. And I think that's where
a selfish cognitive challenge.
And so I think that's what kind of happened to me. It was like, all right, like I can only teach sit to stand so many times selfishly. Like I felt like I could do more. Like I felt capable of having bigger impacts. Not that those weren't big. Those are obviously big to those people and important. But I wanted to challenge myself more. And then, so I moved on to another position where I got to treat like a really cool population. That's where I really got like my first experience in like sports. None of my clinical rotations had that before. So that was really exciting. I got to work with like a really big team, really high level population. I learned a lot of great experiences there. I think what was difficult for me in that position was just like the lack of autonomy. So everyone was kind of expected to treat a certain way. Everyone, you walk in and like everyone has their elbows in someone's TFL. Like you look down and it's like a row of people doing that. And again, like the population was cool, but I still like wasn't feeling challenged. I didn't feel like I could be who I wanted to be as a clinician. And honestly, if I'm being like totally honest, like I think I would have stayed, but they fired me, which is a very difficult thing that I actually don't think I've talked about publicly, because there's a lot of shame that's associated with that. But I also think that, there are people who've been in similar positions, and I don't want people to feel guilty or bad that just because you had a bad experience like that you can't grow past that and do something really great. And looking back 2 years later, I'm really grateful for that, because I think otherwise I would have stayed and I probably would have, plateaued there. I wouldn't have gotten to where I'm at today. And so in the moment, I was very not appreciative of it. It was a really, really hard time in my life. I second guessed myself a lot. Who am I as a PT? Am I good enough? They don't want me. They work with these high level athletes. Like I suck. But now I look back and I'm like, okay, like I learned something from that, right? Like I learned that autonomy is like super important for me. So far my first job, I'm like, all right, I know the population I want to work with. Second job, I'm learning, all right, now I know that autonomy is something that's super important for me. And then I move on to my third job in like 3 years. And I end up in a place where I had full autonomy, had great coworkers that are like now some of my best friends. And yeah, they came to my wedding, bachelorette party, like my best friends. So I'm so appreciative of that. But I just didn't have a support system there at this company. Like I literally felt like unsupported. I felt like a weirdo for wanting to do better. I felt like I would ask for like a tin deck or equipment, and like I would get turned down like every single time if I wanted to have a journal club or anything. Like you had to do it on your own time. And I was like, how are we going to continue to push the profession forward? How are we going to be better clinicians? And like we're told to do it on our own. Like you need to have a support system, at work, and like just like you do in like your personal life. Like when you go through hard times, like you need to have people around you who support you. And like healthcare is going through a hard time, and like you need your coworkers, you need a team around you to support you to move the needle forward. And if you don't have that, like you're going to crash and burn. That's where I think a lot of burnout happens too. It's not just like the volume of people, but it's like you're, developing plans of care for 15, 20, 10 people, whatever it is, but you don't have a support system that allows you to do it in a way that makes you feel fulfilled is a huge problem. Because then you just go into work and you're just like checking off boxes. And if you're passionate like you or passionate like me, like that's not fulfilling at all.
Feels like an uphill battle that you're the only one fighting and no one else is joining the fight with you to solve a really big problem that maybe not even sure what the solution is, but it's something you're passionate about and that you want to try as hard as you can to find a solution for.
And it's funny too, because I actually had spoken to one of my friends, Rachel, right? So she's actually an orthopedic surgeon, and we're scuba diving together. And we had like a similar conversation where it's just like so interesting. Like this is across the medical field where it's like, if you're the one who wants to do better, sometimes like it's weird. You shouldn't feel like the odd man out for wanting to do better and be better ever, anywhere that you work. It's great if you're comfortable. It's great if like that's not what you want, but like to be that person that wants to do better and feel guilty about it is just not right, because our profession needs people like that. And we shouldn't discourage people from doing that. And that's how I felt.
And we have to find ways to support those people that want to do better so they don't do burnout themselves. Healthcare providers are very altruistic. They're always going to sacrifice themselves, their time, their needs for their patient. And you can only be altruistic for so long. And that's what's really, really hard. So you have to find an environment that sets people up for success to give to their patients and give for the long term, and find ways so that therapist or any healthcare provider can recharge at work, outside of work, so that they continue to give for their patients.
Yeah. So it's like when you're expecting PTs to do obviously the documentation outside of clinic hours and all their learning outside of clinic hours and all this discussion, all this all on their own, they have nothing left for themselves outside of work. Then you have work, and then you're trying to develop yourself as a clinician outside of work. Then you have no life outside of work. And then feeds into like going into work feeling burnt out because you don't have like that work-life balance, right? So, needless to say, I say this all from a positive light now. In the moment, I was not this positive. I was very bitter. I still am very bitter, because I think that a lot of these things continue to be issues, and a lot of PTs are stuck in jobs like this. And it infuriates me, to be quite honest. But I think if I look at it now, I try to think about like, what did I learn at each of these places? Right. And I said, okay, like population, autonomy, clinic culture, and support. And when I was thinking about leaving my third job, I was like, I don't know if what I'm looking for exists. Like, I was like, I really, I'm kind of like a glass half empty person. Like, I don't think it exists. And never did I once want to be an entrepreneur. I'm not like you, who's always wanted to do that. I did it kind of by default, because I was like, I deserve to be happy in my career. I deserve to enjoy my life. My patients deserve high quality care. And if a place doesn't exist that's going to do that for them, I'm going to do it myself. And I guess in between I did do some concierge too on my own.
So that's also now treating one-on-one, visiting patients at their home, or I think you're working at a gym. And that can also be fulfilling. You're delivering the care that you want to deliver for a patient, but then you don't feel like you, again, have any team or support. You're there on your own. You have no one to chat with. You have no one to bounce ideas off of. You have no one else to challenge you, to stimulate you from a intellectual point of view, or challenge your treatment approaches. You're literally just on your own. Yeah,
that's a good point too. Because then I'm like, okay, I'm burnt. You're burnt out, and you're like, okay, I see so many patients. And you treat one-on-one. You're like, okay, but you don't get all of those things, and you still feel burnt out. Maybe you're driving around. Maybe you're doing home health, and you're doing all those things. you're not getting that support. So I think through all of those, I kind of was like, all right, where can I, get all of this? And again, the answer was like nowhere. So I'm going to do that myself. And fortunately, right, like the timing kind of lined up with you guys getting the space here. And I was like, I'm going to start to build that for myself at least, right? Like never once did I think in 2021 that would be growing to where we're at now, where we're like busting out at the seams. We have a wait list, like we have a great team. And it was a very like selfish thing initially. And then like as the years have gone on and our team has grown, I think what's continued to keep me so passionate is like to create that opportunity for other PTs. Like, yes, like it started with providing high value care for our patients. And like, that's always going to be the most important. But I also think that if you don't take care of the people who work for you and create an environment for them that fulfills them, that in turn is going to affect obviously like the level of care that's being delivered. So I think that like my passion now has shifted a little bit to creating a clinic and an environment for PTs that they can have that you can have the autonomy, you have a support system, you have your ideal patient population. Like I meet regularly with my PTs, like Dorian loves basketball, like, right? So we're like, right, how can we work with more basketball athletes? Monica loves, performing arts. Like we're working on a dance workshop, a gymnastics workshop, like anything I can do to help them feel fulfilled and to keep them invested in our profession is better for the patients, is better for them, and is better for the profession.
They're the ones ultimately providing the service.
Exactly.
Right?
Exactly. So you need to take care of them. So I think that that's where like my passion's just like really shifted recently. And maybe not so recently, just I think I've become more consciously aware that that's how my passion has changed. And I just love my team and like it's good vibes all the time. Like, everyone's happy. Like Dorian keeps me on my toes. He's like a walking encyclopedia. I love it. Yeah. And like everyone just pushes each other to be better. And I was like, this is what I wanted. This is what I've always wanted. Yeah. And it's just like crazy that we have it.
Yeah. And we have to create things that we want to see happen in the world. And you mentioned the second one, autonomy. What I don't know if many people realize is that there's many ways to solve a particular problem, especially in musculoskeletal health. Yeah. Someone could have back pain. There's not just one approach to back pain. Digging in someone's TFL with your elbow can work for someone. It can work for, it can not work for someone else.
Yeah.
And being stuck in treating one way and not having that autonomy, you may find success with that, that pattern and that treatment approach for certain people, but you won't find that success with others, and you won't be continually challenging yourself and growing that way.
Yeah.
And having that autonomy is really, really important for the type of physical medicine rehabilitation that we do. Because it's not
one size fits all.
One size fits all. No. Cut this happens, or fix this. It's not a fix. It's not like a car. You don't just replace a part and all of a sudden it works.
Yeah. Yeah. I think that's a really good point. Because like autonomy, like that's why that level of autonomy is important, because it directly also impacts patient results. Because if you treat everyone the same, everyone with knee pain is a little bit different. Everyone has different sensitivities, different aggravating factors, different psychosocial factors that need to be considered, that when you have 15 to 20 minutes with a patient, there's no way you're getting into, right?
Yeah.
So yeah, like I think there's like a lot of different things that go into that. And I'm just really fortunate and feel very blessed and lucky to kind of be where I'm at and to give people options. And I think that's the thing too, is like what I don't want people to think when it comes to like prehab PT or like really any cash-based model, like it's very easy to get into this conversation of like cash versus like insurance. Cash is better. Like cash is not better. It's expensive. Like it's definitely more expensive. It's a luxury that not everyone can afford. Insurance is a great option if you have like, like it's a low complexity issue, it's acute, it's not chronic, no real psychosocial things, like a straightforward cookie cutter plan, or even just like getting lucky and getting paired with a stellar PT might work for you, but not everyone gets that lucky, right? Some people will get paired with that PT who has no interest, has never seen an ACL, and is squeezing their quad and telling them if they skip, they can run. Like that might happen to you if you don't do your homework. So I think that the autonomy idea ties in because people need to have options. And that's what we are. We are an option. And sadly, like we're not people's first option because of the price tag that comes with cash-based clinics, which I'm sure is something that like a lot of other, cash-based clinics can relate to. But yeah, I don't know. It's something that I feel like people deserve to know, because if something doesn't work for them, I want them to know that they're not a lost cause.
Exactly.
Like try something else. Like you didn't fail PT might have failed you.
Yeah. Yeah.
And I tell people that all the time. It's something that I really firmly believe in, because I've seen so many people walk through our doors that like, again, I see a lot of like ACLs, right? It's like you're 10 months out. I'm like, oh, have you ever been tested? No. There's like literally hundreds and hundreds of articles, one of the most researched things in rehab and PT, and like people are still not really doing it the right way. So yeah, people just deserve to have options, you know,
And
be
it's not
educated.
necessarily, again, that one is better than the other. Like you're saying, it's not that one's better, one's worse. It's that there are different options. Even going back to the autonomy, a PT at our clinic can treat a little bit different than another PT.
Yeah.
There's a different treatment approach to tackling different problems. And
Yeah.
it's making sure that you understand that the PT that you are working with, if you're a patient, that you feel like that PT understands you, that PT is listening to you,
Yeah.
and that PT is critically thinking and adjusting their plan of care when things
Yeah.
aren't working.
Yeah.
Which is very, very important.
Yeah. Yeah. Treat the person like a person. I think that like personal relationship is really important as well. Like, how do you get that buy-in, that trust? It comes with like really just like understanding that person in front of you. So I think for us, like, that's why we do like 90-minute evals, which I feel like is
Yeah.
like relatively unheard of. Like, I'm sure it happens, but like most places, like, you're lucky if you get an hour on your first visit with a PT. Like, I would say out of our 90-minute visit, like, I would say like at least 30, if not 45 minutes. I'm like just really like talking.
You're just chatting, getting
Yeah.
another person and understand their history.
Yes, of
Yeah.
course. You can like learn a lot about like their injury, the pathology, and just them as a person. And like there's a lot of times you're talking with someone and you're like, wow, this person is like really fearful and anxious. And like your exercise programming and your testing is going to change just based on understanding that alone. And if you don't take the time to learn that, you're going to put someone through like a max effort quad test or whatever, and they're going to be flared up, they're going to be upset, and they're never going to come back, right? And they're never going to get the help that they really needed. So understanding the person's really important too. And again, I feel like I just like never got opportunities like that before, and it's something that I really value. Like, I feel like I'm a very I don't know, not like empathetic, but like I just like to connect with people. And without that, I feel like we're doing a disservice to our patients. And I think it's part of being a physical therapist. And I just feel very lucky that I get to do it.
Well, we focused a lot of the conversation on like how PrehabPT is a great place for clinicians and how we have to take care of our clinicians because they're the ones ultimately providing the service.
Yeah.
And then when it comes to PrehabPT and the service that patients can get here, we touched on the 90-minute evals, how important it is to feel like you connect with your therapist from day one.
Yeah.
What are some other things that we offer at PrehabPT or that we're able to provide an environment for our patients that you feel like really elevates the standard of care that they get as a patient?
Ooh.
Outside of our 90-minute evals?
I mean, I think it's similar answers where it's like, I think we just like are so invested in the person. Like, we're in it with you. Like, I think all of us like really like look at like that therapeutic alliance of like the patient with the therapist. Like, we're in it together. We have like constant communication with the patients, not too constant. Like, please don't text us in the middle of the night, obviously, unless you're a certain patient who sends me photos of her doing random things and I love her for it. But anyway, I think having a good like therapeutic alliance with the patient, a good relationship with like referral sources, I think is also really important. Something that we've really honed in on. I think a lot of the people like we see who have like failed PT in the past, like it's because like their doctors are telling them like you haven't met this, you haven't done that, whatever. And so we try really hard to communicate with whoever is like referring the patients to us so that they feel confident and comfortable that we're all on the same team. We're all working towards the same goal. Because I think it's important to understand that like doctors have their specialty and physical therapists have theirs, right? And it's important that everyone respects each other and where they're placed in that team. So again, like I think people come in here and leave walking out like they have a whole team behind them. They're not in their rehab. Yeah. They're not doing their rehab alone. Like, your doctor knows what's going on. Their PT knows what's going on. They have a customized program that's like, they can follow through an app. Like, we try to minimize barriers and make it as easy for them as possible. Like, one of the things that I talked to back to the eval is like, what equipment, like one of my most important questions, like what is realistic for you? Like, what do you have equipment? What access do you have? Do you like going to the gym? Do you like working out at home? How many days a week? Are you someone who likes to work out every day for 20 minutes? Or would you rather have like a 1-hour program 3 days a week? And I really try to meet them where they're at, because I think so many times we try to force this narrative of like what we think and know is best.
Or what the literature says you need to do.
Oh yeah. Like when you stop dropping articles on people and like just to show how smart you are, like that's usually not what the person needs. Like, yeah, maybe like one, but But yeah, so I think that that's like something that really is helpful for people. I think when you walk in here, the environment is really positive. Again, like I think everyone working here is happy, and therefore people can feel that. We have a little weekly win board now that we just put up to help people keep motivated.
Yep.
Yeah, which is
There's
exciting.
some awesome wins on the board. We thought that they were going to be all physical types of wins, like I can walk again, I can stand, I can kneel. And there's some funny ones on there.
Yeah. My patient decided like he can make tikka masala. He did not understand the assignment, but like, bring me your tikka masala. I had another patient who has enough knee flexion to to go on her squatty potty.
That's great.
You know,
Squatty potties are great. They really are.
So I think it's just like cool. And again, like rehab's like a long process. So finding little ways to keep people motivated, invested, see the little wins, because progress doesn't happen overnight, you know, and it's really hard. And you know that you're dealing with your back injury. I am dealing with the back thing too. And so I think if we can remind ourselves along the way of like the small things and be a little bit more appreciative, that sets the standard moving forward. And it's, again, very funny because I'm not like this in real life, only when it comes to PT. I'm very not a positive glass half full. I always tell my patients that. I was like, if you meet me on the street, I will probably be the most cynical person you've met. But when it comes to PT,
you got to be positive.
Yeah.
It's important.
I don't know how. I don't know how it happens, but yeah.
Pause.
What? Pause? Like dog pause? Or pause like P-A?
P-A-U-S-E. Yeah, you saying you are a positive person with your patients and normally not the most positive, I think is a very accurate statement. We've known each other throughout many different types of, as you can say, relationships, and being able to separate maybe how you are as a professional at work versus how you are as a person at home, I think is really, really important, especially if you work with your significant other or spouse, or if you're thinking of working with your significant other or spouse.
Yeah.
We've now been working together for 2.5 years. And there's definitely a lot of learning that went into it. Figuring out, okay, what type of topics can we talk about? When is the best place? When and where is the best place and time to talk about them?
We definitely haven't mastered it.
We haven't mastered it. No, you're always going to be learning.
Yeah.
But for example, we now set meetings at work. Like we have meetings just like I meet with any other person on the team. We have legitimate meeting blocks where we set an agenda. We say, these are the times that we're going to talk about these things. Of course, there are times when we're both passionate about a topic and we're going to talk about it at home.
Yeah.
But we try to talk about the at work in this work setting and not bring home that work with you.
Yeah.
It's a lot easier said than done when you're really passionate about the work you're going to bring it home with you.
Yeah. Yeah. I think we've tried a lot of different strategies, and like it's kind of cool too, right? Because it's like we're both very passionate people. So I think it's like unrealistic to think to keep it at work all the time. But those lines can get very blurred. I think at one point we were like, okay, we'll set a timer when we get home. We only can talk
that for like a month.
Yeah,
like
and literally timer goes off and we like just keep going.
Yeah, that one didn't work too well.
That strategy did not work. But yeah, I do think having the meetings at work are better because it allows us to like kind of delineate a little bit. And I think both of us do struggle with like work-life balance, you know. We're very passionate. And I think it's something that a lot of PTs, to your point, like we're always willing to give, and that's just in our DNA. So it's really, really easy to get lost in that. But it's also like not really healthy for our relationship or relationships with other people, for ourselves. So I think that's like one avenue that has been successful. I think communication is also really important. Also, if anyone watching this has suggestions and works with their significant other, make sure to drop
in the
those.
comments.
Please. We used to try to drive together all the time.
Yeah, that's
because we felt like we needed to. We're like, oh, we work together. We must
should
drive
be carpooling.
together.
We should be saving the environment, even though we have an electric car. And now we basically don't carpool together.
Yeah, because that would create like a stressor. We'd be like, because we have different schedules, and you're like, I need to get here at this time, I need to get here at that time. So I think also creating separation.
I was just gonna say,
like
the
creating
separation is important because at home you typically don't have that separation. Maybe you do, but at work, that's your separation from your significant other or your spouse. Whether that's a good thing or a bad thing, but that's just physical separation. But when you work in the same physical environment as your spouse, and then you're also passionate about the same things, then it seems like all the time you're working or talking about the same topics.
Yeah.
So having that separation by us driving together, even though we may be on the same schedule. Today we both got to work basically 20 minutes apart from each other. I could have just waited 20 minutes, but no, we're going to drive a little bit separately. Or one of us trying to work from home on a different day from week. If you're going to work from home on one day, well, I definitely not going to work from home on that day. That's your time. Yeah. I'll try to work from home from another day.
Yeah. I think it's like the time thing, right? It's like, okay, like we each need to have our own time, right? But it's also the idea we're here together all the time. And I feel like this is something that relates to anyone who works together with their significant other, not just like in a PT space. Like you spend a lot of time together, but it's not quality time. Like, so it's really easy to get like lost and like forget. You're like, oh, we spent all day together. Like I'm going to go do my own thing. Right. But it's not quality time. And then you're just going through the motions. So I think also finding time and like prioritizing and like even just the awareness that that's the case to make sure that you're setting time on weekends to go to dinner, or hang out by the pool or whatever it is to like make sure you're having quality time and time alone. So just like being really conscious of the type and like where you're spending your time as like a couple. And then communication too. I think we're continuing to work on that. It's like how you communicate with each other at work might be different than at home. But also just opening lines of communication. I feel like that's important in any relationship, like a spousal, coworkers, being open, honest, comfortable. I think that it works to our like benefit to a
100%.
degree.
I've learned a lot. Like I'm naturally a problem solver. That's why I've loved entrepreneurship. Entrepreneurship is problem, figure out a solution. Problem, figure out another solution. Another problem, figure out a solution. And then in our relationship, when we're discussing things at work, my brain will go directly to a solution. That's what I normally do. But this is what I normally do. I would go straight to a solution. But it's like, well, just because we're talking about the business problem, maybe you just needed time to vent, and I just need to listen. Yeah. And I've learned now to ask or pick up on cues of what role do I need to serve right now? And that's been really important, because just like in business, you wear multiple hats. In a relationship, when you work with your significant other, you're also wearing multiple hats. You could be a coworker on one conversation. You could be a spouse on another. It's important to recognize what type of conversation you're happening with when. And that's not just when you're talking with the spouse, but it's also talking with any coworker. Are you your coworker now? Are you a friend? Are you their manager and their boss? And being able to understand the situation, read the room, understand what conversation you're in has been very helpful. I know for me, develop some of those skills. Yeah, I think it's a good point. It helps develop, because I think it's like you come into the conversation with like a different person. You're like, which hat am I wearing? And that can apply to, I'm just going to repeat what you said anyway, but yes. Yeah, exactly. And I think too, like we work together. We also work with like our good friends. So like, it's like a very similar idea, very similar idea. You're like, sometimes we have our meetings and it's like, let's talk as friends. Let's talk as this. Like sometimes I want to be like, okay, just pre-warning, I'm going to be slightly unprofessional right now because I just need to like vent as a friend. And then we switch back to business mode. But I think being able to like delineate and like have that. And also again, going back to creating a comfortable workspace where like you can do that, and you can be comfortable enough with the people who work around you. And while it complicates things, working with your friends, working with your significant other, has a lot of benefits to it, and I enjoy it. It makes me feel very comfortable and safe. I have full trust. Yeah. You know what I mean? Yeah. In you, I have full trust in Craig. I have full trust in Arash, because we've all known each other as best friends or in other forms of capacity outside of now coworkers or business partners. Yeah. Yeah, very much so. It's like, you're invested in the person as a human. Like that's everyone obviously who like works here, but it goes so much deeper and longer, like we go to Tulum together and, on all these different vacations, which means also we're due for another trip, but not on a cruise. Mike has been trying to get Prehab the whole team to go on a cruise. I want everyone to go on a cruise to Mexico, and everyone's kind of like, I don't really know. Yeah, because no one likes to cruise except for you and your family. Yeah. I guess. And I mean, other people, I'm sure there's other people on the cruise, but also like we love each other, but like not enough to be trapped on a boat with your coworkers for like a week. In a small box. A small box with no windows. Yeah. It's literally like how a horror movie starts. I feel like I do really like, again, I feel like I'm very appreciative. This is very strange of me. This is very outside of the norm. I know. It's because I'm at work. But it's great. Every time I walk into these walls, all of a sudden I'm like miss positivity and appreciation. But I think it's been like a really cool experience, and I've learned so much, and I really just enjoyed this conversation because it has been a good point of reflection for me to be like, wow, like I have it pretty good. And our team and the things that we're trying to do for people, we hit on access. Like access is everything for this company, whether we're talking about the in-person business or we're talking about the online business. Yeah. We want to make sure that for the 6 billion people that have pain, you have options. You have so many different options. It could be cash or insurance. That's an in-person clinic. It could be doing our programs on the app. It could be not even doing any of your programs and just watching our YouTube videos and learning yourself. But when you have pain or you're dealing with something, you don't want to feel like you don't have a plan and you don't have options. And when you are able to, go through one option and, hey, it's not working for you, you have another option. You're not just stuck with one thing. And I think that's what's wrong with healthcare right now, and especially thinking about how traditional healthcare works with insurance is you get provided one option, one route. And if it doesn't work, you feel like it absolutely failed. You failed, when in reality, no, the healthcare system failed you, like you were saying. Not that you as a patient failed, healthcare system failed you. Yeah, I agree. I just keep thinking like I feel, and this is me being negative, yay, look, see, my real me comes out. Like when people walk in here or they leave our sessions, for example, like it almost like upsets me how amazed they are. Like how... It upsets you? Well, yeah. I think it's amazing.
Yeah, I'm sure, but like it upset. I'm like, why is this so outside of the norm of what you're used to?
Yeah.
You know, I'm like, why is it that like, oh my God, you get an exercise program with videos?
Yeah.
What? I'm like, I'm sorry. Like, have you been trying to learn how to deadlift from a stick figure?
Yes, unfortunately.
Well, yeah. I mean, luckily it's also a lot of straight lines, so it's like
Yeah.
maybe not the best example, but like, yeah, like it like upsets me. And so I think like the idea of access and like being able to just, it's so important that more people do what we're doing. Like if people are out there thinking about entrepreneurship or anything, like I feel like do it because like our healthcare system needs you guys, needs people, because Lord knows, like, you know, our certain groups are not really doing it right now for our field. Maybe doing it in their own way, but really not moving the needle forward. And we're failing people, you know?
And we have to continue to find a place that can support our therapists
Yeah.
so that they can provide good quality care to our patients,
Yeah.
or like you're saying, drive other forms of entrepreneurship, other
Yeah.
ideas that you may have that you can help people remotely or through digital
Yeah.
solutions like what we're doing on the online
Yeah.
business.
Yeah.
Ultimately trying to allow people to have access and
Yeah.
options.
Yeah. I think it's important. I think, you know, we're doing the best we can, like, you know, and doing it different ways. Like I'm doing it in person. You're doing it more with the online business, but like, at the end of the day, like working towards the same mission,
goals.
same goals. And I love it. And I want more people to do it.
Yeah.
Yeah. Yeah.
It was great chatting with you. First podcast in the books.
Yay. Let's do it again sometime.
Yeah, of course.
Okay.
Where can the audience find you?
You can find me here at Prehab Physical Therapy in Los Angeles, California.
And what about online?
Online on Instagram at NotYourBasicPT. That's basically it. I don't do the X verse or whatever, Facebook, just Instagram. Or you can find me at the West LA Animal Shelter because I do volunteer there too.
Do lots of volunteering there. So thank you again for coming on the show. If you guys have any questions, the audience, please drop it as a comment. If you have any topics that you'd like for us to talk about in the future. And thank you for watching.